Our last guest is Dr. Stephen Robbins, a new urologist in the area. Welcome to the show today, Dr. Robbins.
Thank you.
It's a pleasure to meet you. This is the first time we've met, and I'm looking forward to learning lots about you today. So I understand you're new to the area, and how do you like it so far?
Besides being greeted by a hurricane or a tropical storm on my first week here, everything's perfect.
The weather's great. It's a little warm, but
I'll get used to it.
You'll get used to it. That's right. Well, where did you relocate from?
I relocated from New York.
Uh-huh.
I was working in Glen Cove, which is on Long Island, and left 17 years of practice there to move down here.
Wow, 17 years in the same practice?
Same practice.
Wow, that's awesome. Yeah, so you decided to move south and enjoy the sunshine with us.
Correct.
Great, great. Well, we're happy that you're here.
Thank you.
Well, talk to me a little bit about your work and your educational background.
I was educated in New York.
Uh-huh.
I went to medical school at New York University, which is in Manhattan. And after 4 years of medical school, did my urologic training also in Manhattan at Mount Sinai.
Oh, Mount Sinai. Great,
So
great
spent
area. Great facility.
long time in the city.
Yeah.
And then when I left Mount Sinai, I went to practice with another graduate from Mount Sinai in Glen Cove, which is on Long Island, and worked there for 17 years.
Wow. Well, that's quite different between Long Island and here, would you say?
It is different, but a better different.
Well, that's nice of you to say. So you have specialty training in urology, and where are you going to be located?
I'm working at Novant Health in the Brunswick Medical Center. The office is on the medical center campus.
Yes. And you do have a partner, is that correct?
Yes, the partner, Dr. Lydia Labachetta, who's been working there for 1 year.
And she's been on our show.
And I'm joining her and joined her 1 month ago. So it's kind of difficult to be in practice by yourself. It's going to be a lot easier for both of us to have a partner.
Yeah, that will be good. Now, some of our viewers may not know what a urologist is, so let's kind of start with the basics. What is a urologist?
Just an overview of what we do. We diagnose and treat the urinary system in men and women. So that includes the kidneys, the bladder. And we also take care of the urinary system and the reproductive system for men, which includes the obvious external organs and the prostate.
And the prostate. I hear a lot about prostate.
It's a pretty popular diagnosis these days, especially on the news.
Yeah, especially on the news and on the TV commercials from the drug reps, the drug companies. Do you have any other special interests or areas that you're interested in?
I am a general urologist, so I have no subspecialty training, which I think is great in a community like this because
it is.
In a community hospital or in a smaller community, you don't really need a specialist. If we need something, if Dr. Labachetta or I need help in diagnosis or treating subspecialty that we're not comfortable with, we have great medical centers around here to send them to. So I am a general urologist.
Good to know. But I understand that you do some procedures here, some specialized procedures like for kidney stones.
Correct. Urologists have two components of our practice. We're in the office seeing patients, and we're also in the operating room. Okay. In the operating room setting, one of the things we treat is kidney stones, and I'm learning very quickly that we're in this, what we call the stone belt, and there's a lot of kidney stones around here. So minimally invasive therapies are available for kidney stone treatment. They include lithotripsy, which is sound wave or shock wave therapy. Very simply, you lie on a table, a machine goes under your back, and you break the kidney stones up into little pieces, and they pass without too much difficulty.
Does it hurt when they
Not really.
zap those?
You're kind of sedated, so it's not very painful. Okay. The second option of treatment we have is laser therapy. That's done in an operating room setting.
I didn't know about that.
You need to be a little bit sleepy, and then we insert lasers into the kidney and break up the stones that way.
Wow.
And the goal is to get the pieces small enough so when they move and they pass out of your body, they don't cause blockage and they don't cause pain.
Well, how big are they to begin with, generally speaking?
A stone can be any size. It can be a centimeter, 2 centimeters, which is like an inch. Stones won't come out by themselves if they're any bigger than like 1/4 of an inch. They'll get stuck.
Wow.
And when they get stuck, it's quite painful, and we meet the patients in the emergency room.
I've heard they are painful. I've never had one, but
It's quite impressive how you can take a grown man and bring him to his knees with a very small stone.
yeah, they seem like they're so small that they could just pass. But well, those are interesting procedures. And now I know that you also see patients with incontinence. Is that correct?
Correct. So incontinence can be in men or women. In men, a lot of times incontinence is associated with the prostate. So we either treat them with medication or minimally invasive surgical procedures, also with the use of lasers. For women, incontinence is usually treated with medication or surgery. The surgery is for what we call stress incontinence. Stress incontinence is where you leak when you cough or you dance or you run around.
Okay.
And the medication is for what we call urge incontinence, which is when you feel like you have to run to the bathroom and can't get there quick enough.
Yeah.
And you're leaking on the way. That's the medication treatment.
That's the medication side.
Correct.
Ah. I'm curious, do you see patients with cancer?
Yes. Urologists are the primary diagnosticians and treatment for cancer of the kidney, cancer of the bladder, in both men and women, and cancer of the prostate.
I hear a lot about prostate cancer. It seems like
it's
very prevalent.
Yes, and there's a lot of controversy about who should be treated, who shouldn't be treated,
how old, and
who should have surgery,
yeah,
who should have robotic surgery, who should have radiation, and we could spend hours talking about that.
Yeah,
It's
we could. That
quite-
would be
quite
that's another
complicated.
show. Will you come back and talk about
Sure.
that? Okay. Well, do patients need a referral from a primary care to see you?
Some do. It really depends on their insurance.
Oh, I see.
The easiest way to figure it out, to get an appointment to any specialist, is to ask your primary care doctor. If you're not sure, if you call our office, the staff will lead you through the maze of insurance to figure it out.
They can pretty much help you with whatever your insurance plan is.
Correct.
They can determine if, in fact, you need a referral. Is that correct?
Correct. Some insurances don't need referrals,
Right.
some do.
Yeah. It's funny. My husband and I have both different insurances, and I don't need a referral, but he does.
For instance, Medicare does not need referrals typically, and so younger patients less than 65 who have insurance through work may require it.
Yeah. Well, that was great information. It's been a pleasure to have you on the show today. But
Thank
before
you.
we wrap up, is there anything else that you would like our viewers to know?
The office is open 5 days a week, pretty much 9 to 5. And anytime there's emergencies, we're always available through the emergency room at the medical center.
Awesome. That's great. Great to know. Well, thank you so much for being here today.
Thank you.
I look forward to having you back, and we'll talk about another interesting topic around urology.
Thank you very much.
Thank you.
Pleasure being here.